Hey, my name's Dr. Daniel Cook. I'm the inventor of the airq airway devices. I've spent the last 15 years of my career as an anesthesiologist designing and developing airway devices, and this is my latest device. It's called the airq blocker. The standard airq device is a soft masked laryngeal airway. Now the airq devices all have similar features. One is that the connector comes off so you can put large bore endotracheal tubes, because not only is airq a standard airway device, it's also a rescue device that you can put endotracheal tubes in the trachea very easily. Once the endotracheal tube is in, it's just simply a matter of using the removal stylet to hold pressure on the endotracheal tube as you remove the airq device, and you can simply take the airq device out and leave the endotracheal tube in the trachea. This particular version of the airq is called the airq blocker, and it was designed specifically for emergency medicine. It has two features on it that, in addition to the normal airq. One, it is a very soft bite block that's functional, so it won't break teeth, but it's very efficient at keeping patients from occluding the airway. The second feature is this guide tube. Now, it guides things into the esophagus, so anything that goes on this end will come out this end, go along the bottom of the mass bowl and into the esophagus. So why would you want to use that feature? Well, one thing is you can put standard large bore OG tubes into the patient. This is an 18 French tube, as you can see. It easily goes through the guide tube and into the esophagus and down into the stomach. Another device I have that works very well is the blocker tube. The blocker tube is basically a suction catheter with a balloon on it and a multi-orifice tip. So if you do the lubrication on the airway blocker tube and run it up and down into the guide tube, you can simply pass the blocker tube into the esophagus, blow the cuff up, and now you have the esophagus blocked here, you have the esophagus blocked here, and you have a vent tube distal to the blockage. So it's a little bit like having a laryngeal mask airway and a laryngeal tube built into one device. I think the real secret with airq is the function of the device itself. As you can see, it has a removable connector that allows the endotracheal tubes to go through the device. It has a very nice curve and a very serpentine shape, which is very anatomically shaped so that it's very functional and very stable in the patient. Very easy to place this device. The two other features I'll show you are the large bowl and the internal structure I call the tunnel. The large bowl allows you to trap the larynx inside the mass bowl, and the tunnel deviates the epiglottis up on top of this tunnel, opens up the airway, puts the epiglottis in a stable upper position so that the tissue can't collapse into the bowl. It maximizes the airway as a conduit for breathing and also maximizes the airway as a conduit for intubation. So it functions two purposes. Once you put the device in, if you want to remove this later, you can easily take this out by just deflating the cuff. And I think the secret of the airq blocker as an EMS device is the transition between the emergency medicine in the field and the emergency medicine practitioner in the hospital. What's missing in most of the airway devices is that transference from one to the other, because once they go into the emergency room, they're going to want an endotracheal tube. With the airq, if you bring them in with this intact, the practitioner can simply remove the cap, put an endotracheal tube through the trachea, and without manipulating the neck or moving the patient's head. So it's a very easy transition. So I think it's the only airway that actually makes the transition from the practitioner in the field through the entire setup to the practitioner in the emergency medicine, and allows everyone to do their job without sacrificing the ability of the patient to breathe. For more information for the airq blocker, please visit Mercury Medical's website, mercurymedical.com.